What is minimally invasive hernia surgery? Well, in the old days, hernia surgery was done with a knife and an incision that would be about 6 to 8 inches long. The patient's recovery would be about 4 to 6 weeks after surgery, and the patients would be in excruciating pain. Well, with newer technologies and in medicine, as well as especially in surgery, we're now able to do this type of operation through little incisions. And I've developed a technique where we use one incision to repair both sides. The recovery is much faster. Patients have minimal pain, and they're able to go back to their activities of daily living, their gym, whatever they do within 2 weeks from the operation. Why do we need to repair a hernia? First off, let's talk about what a hernia is. A hernia is a hole in the abdominal wall, and like any holes, they eventually get bigger and bigger, and if you don't repair them, stuff that is separated between the abdominal wall and the abdominal cavity will intermix. We need to fix the holes. An analogy would be like a roof. You have a hole in your roof, and all of a sudden the hole gets bigger and bigger. Now you have a bigger leak in the roof. So we'd like to fix those holes in the roof when they're small. How is minimally hernia surgery performed? Well, it's performed using a camera where we put, so we can see inside the body, and using another small incision, we can put our instruments in and we can repair the hole that the body has, and we can either do it with stitches, or sometimes we use what we call a piece of mesh, which is a fancy piece of plastic that we put inside to help bridge and cover the hole that the body has. What are the alternatives to hernia surgery? Well, again, let's look at what hernia is. A hernia is a hole in the abdominal wall. If option one is to do nothing, the hole will continue to get bigger and the problem will get worse. Option two is to fix the hernia. If we fix it, there's several ways we can do it. One is to do it laparoscopically or minimally invasive surgery, and the other way is to do traditional open surgery. The minimally invasive surgery has multiple benefits associated with it, which include less pain and a faster recovery. However, not all patients are candidates for minimally invasive surgery, and therefore we still do traditional surgery when needed. What are the benefits of minimally invasive hernia surgery? Well, there are multiple benefits. The first benefit is patient pain. Nobody wants to have surgery and be in pain. The pain associated with this operation is very minimal, and the patients go home the same day. The recovery is much faster. They go back to work within 2 weeks, and within 2 weeks they're back at the gym or back on the golf course or swimming or whatever physical activity they like to do. There is also a cosmetic benefit. The incisions are so small that within 6 months to a year you'll barely see the incisions, and no one will ever know you had surgery. So what is the recovery after minimally invasive hernia surgery? Well, the patients come into the hospital, they get operated on, and these patients go home the same day, usually about 3 to 4 hours after their initial arrival. And when they're at home, they're able to walk around, go to the bathroom, get a drink, and they can eat. In fact, they can even shower the same night if they choose. Most patients choose not to, though. In terms of recovery at home, the first 2 weeks, they're only allowed to walk, and patients can drive when they're not taking any narcotics, and that's really individualized to that patient. Each person has a different pain threshold, and usually the recovery is within 3 to 4 days at the most. By that time, most patients are up and running and driving. By the end of 2 weeks, they're able to go back to the gym, go back to work, and go back to whatever lifestyle they had, whether it's biking, hiking, gymnastics. There's no limitations.